So thank you for joining us in the SDG Media Zone. I am Jerome Bernard. I work for UN News, and I'm here with Dr. Sylvie Briand, who is the Director of Pandemic and Epidemic Disease at the World Health Organization, and with Melissa Fleming, who is the UN Undersecretary General for Global Communications. Thank you for joining us.
Great to be with you, Jerome.
Thanks for inviting us. Thank you.
So the interview is going to focus on two important topics during this COVID-19 pandemic crisis: the search for a vaccine and misinformation. And so I'm going to start with Dr. Sylvie Briand. So the pandemic started months ago, and people's lives around the world have been in turmoil. And people are waiting for a vaccine to start their lives again. So could you tell us where we are in the search for a vaccine? And what are the challenges?
The first step for a vaccine is indeed to first know the pathogen. And I think in this pandemic, what has been really incredibly fast was the discovery of the pathogen and the definition of its gene sequences, because based on that, you can do a lot of things, not only the vaccine, but also develop diagnostic tests and so on. So this information is really critical. And as soon as we had the name of the virus, basically, and his ID card through his genome sequence, it has been possible for many academic research centers to start developing a candidate vaccine. So these are only candidates, meaning that using different technologies, you start the process, but it's not by no means the end of the process. It's a very complex and very long process with different phases. So currently we have a huge number of candidates, actually more than 150. And many groups in different countries working on developing those candidates. But then after this initial phase is done, you need to go through phase 1, 2, 3, which are basically phases where you will first assess on animal models if the vaccine is useful, and then you will assess its safety, and then you will assess its effectiveness in humans. So the safety is in humans as well. So each phase requires a lot of work, because you need first to enroll volunteers, especially for the clinical phases, making sure that it's still safe for those people so that they don't take too much risk, especially for a disease when you don't have treatment, like for COVID-19. And it takes a long time first to enroll people, so you need to have enough subject to do the test, but also enough time also to analyze the data. And so many vaccines now many candidate vaccines are now in the clinical phase where we try the vaccine on human, but it's very important to do those phases well to ensure the safety of the vaccine. And the safety is not only immediately when you inject the vaccine or when you administrate the vaccine, but it's also some follow-up after a few days, few months, to make sure that really the vaccine is safe.
And there is this initiative that was launched in April, Accelerator, to accelerate the development of treatments, but also vaccines. And could you tell us where we are now and how successful this initiative has been?
So the ACT Accelerator not only aims at accelerating the research for a vaccine, but also accelerating the production and the scale-up of this vaccine production, because we need a vaccine for as many people as possible, of course, and as rapidly as possible. So it's an entire process that needs to be accelerated. And so far it has been very successful, because on two fronts. The first front is really the research itself, because advocacy has been made to support research groups. So many groups now have been able to not only develop the candidate, but also go into the clinical phases of trial of the vaccine. And so in record time, usually it takes many years, and now it's a matter of months. So I think it's very successful in this regard. But also what is very successful is the fact that Accelerator brings together a number of partners, not only partners upstream for the research part, but also partners downstream for the production, for the scaling up of the production, but also the delivery. And so it includes, of course, a number of stakeholders, academia research, but also private sector for the manufacturing, and also some partners, international partners such as Gavi, for instance, or UN agencies like UNICEF for the deployment and the procurement of those vaccines. So it's really an end-to-end process, and we hope that each phase can be accelerated. And to accelerate this process, what we have tried is really to conduct in parallel different things. So the research is going in parallel as priming manufacturers that it will have to produce at scale, and priming also all the procurement, the regulatory, and all the partners that will be in the delivery stage. So we are all working together right now to make sure that the phases are not sequentially conducted, but really in parallel, so that we can achieve results much faster than in normal time.
And do you have the impression that the general public doesn't understand how complex the search for a vaccine is? And are you worried, what's the most worrisome for you in terms of misinformation regarding the COVID-19 vaccine?
I think what is difficult in the current period is first that there is a lot of fear of the disease and a lot of anxiety from the population, as well as still a lot of uncertainty, because it's a new disease and many things are first time in this pandemic. And so misinformation is already there. It's not something that will start with the vaccine. It has started many months ago about the source of the virus, about the disease itself, about the potential treatment or cure that can be administered. So we are really already in a situation where there is a lot of misinformation. And when people are anxious and uncertain about a number of things, they tend to compare with things they know already, or things they have experienced in the past. And so here, what's become difficult with the vaccine issue, because certain people have already preconception about vaccines or fear about other vaccines, not this one, because this one doesn't exist yet as a vaccine to be administered to people. So, and they have a lot of fear that are already adding to the fear that exists about COVID-19. And for example, one of the fear people have is that this vaccine will not be safe, or they will be obliged to take the vaccine and they will have no choice. And so what is very important in this period now, because we don't have yet the vaccine, is really start building the space for a very open dialogue, a two-way dialogue with population, so that we can hear their concerns. We can and answer their concern as much as we can. For instance, because it's a production of biological product, it's very complex, but we have experience of developing those products. So we know what phases are more dangerous than others, and what phases need to be particularly monitored, so that we ensure that the vaccine is safe. So we need to discuss with the people and convey those messages to reassure them and explain to them these very complex processes, but not in a way that is only disseminating information, but really understanding each other and answering the question they have at this point in time.
Melissa Fleming, I'm going to turn to you and ask you also about misinformation and what's the most worrisome for you. besides the misinformation regarding the vaccine, misinformation about the pandemic in general?
Well, obviously, I mean, if we could start with the vaccine, but in general, what Sylvie just said is that the misinformation started as soon as the virus was announced. And misinformation isn't new. We've had misinformation as far back as you look in history. The difference here is that we have a global pandemic that is happening in the social media age. And that means that we have a great opportunity to reach people with good information, solid public guidance, health guidance based on science, WHO, guidelines, advice. However, WHO coined the term infodemic at the start of this pandemic, which means that there is not just good information circulating out there, but it's mixed with bad information, bad science produced by bad actors. And the result is that the public that is on the receiving end is having a really hard time navigating and distinguishing between what is good and what is bad, what is misinformation, what is disinformation, and what is really information based on science. And that's where we come in, and we're really trying to not only produce the science in a way that is more accessible, more interesting, more social media optimized, so that it does go into people's feeds so that they do see it, but also to educate people around the world about what is information, how to spot it, and also how to talk to friends and family about the kind of misinformation and conspiracies that they're being exposed to and maybe believing.
Could you tell us what kind of some of the initiatives taken by the Department of Global Communications to tackle this misinformation?
Yeah, well, as soon as we saw how misinformation and disinformation were spreading almost as fast as the virus itself, because of the nature of social media algorithms as well, and because of the sleek productions of some of the purveyors of misinformation that created content and videos based on pseudoscience that was actually slick and much more entertaining than the kind of material that we were producing. We decided to start an initiative to counter misinformation, and it's called Verified. And what Verified does is it offers the public content based on science, content that is simple, accessible, human, content that also is based on the study of behavioral science. So when we're talking about a vaccine, we look at what people are fearing, as Sylvie was just explaining. People have legitimate fears, people have legitimate concerns, and we want to be listening to them and addressing these fears and concerns with information that they can access and understand. We also, the Verified initiative is based also under the understanding that we can't just broadcast information from UN headquarters or from WHO headquarters in Geneva. What we need to do is to get to where people are accessing information. And in the social media age, it's really in Facebook groups, for example, on WhatsApp, in these groups. And what we have now is information that may start in one country, but because of the global network of social media and the diaspora around the world, a piece of misinformation can travel instantly to different parts of the world. So we need to penetrate these groups. And so we're working with social media platforms. We've recruited information volunteers who are our kind of digital first responders around the world, members of the public who are communicating for us in their communities with the content that we provide. And we're working with our country offices to really identify the gaps and the issues and the trends in country and help us to reach out to media partners, influencers locally so that we have a community reach, a community conversation that will hopefully, guide people in the right direction.
I've just read in an article in the New York Times that there's a study published this week. It's a study in the United States that suggests Americans under 25 are most likely to believe virus-related misinformation. And this study has been done by several universities, researchers from Harvard University, Rutgers University, and Northeastern University, and Northwestern. So what does the UN do to target specifically young people who could be, especially who could believe, virus-related misinformation?
I think that's probably a reflection of who is most on social media. It is a younger population, and a younger population that is, getting a digital overload, and so their attention span is probably not long enough to look at the piece of information they're getting and really question it. And this is where we have started a campaign, and we're going to be relaunching it again, called Pause. And what Pause does is introduce a new social norm, kind of like the campaign Don't Drink and Drive, for example, that really started becoming, a norm in the back of people's heads. What we want our new social norm to be is pause, take care before you share. And then for people to be educated, and we're going to be pushing more information out to young people and to everybody about how much misinformation is out there, how to spot misinformation, how to kind of test your own reaction to a piece of content that you see. If it seems to be too good to be true, if you have a kind of emotive reaction, really stop. Check it, see what the source is, and before you pass it on, which is kind of human nature in the social media age, really make sure that it is legitimate before you share. We believe, and we have evidence to believe, that if people just took this 30 seconds break and really question what they were seeing, this would go a long way to stopping the spread. But it's not going to stop it completely. And I just want to end by saying what we really also need is more work by the social media platforms to not just flag misinformation, but really stop it in its tracks.
What we do, I think on the youth, it's a very important subject. And what we have done is, because for us, infodemic is a tsunami of information, as Melissa said, good and bad. But because people are overwhelmed with information, it's very hard for them to distinguish what is good and what is bad. So, but we think also that if you give more good information to people so that they can make informed decisions about their health, then they are less likely to listen to misinformation. And so what we have done is also using amplifiers for this good information. So we have been working through the EpiWin platform with different groups of youth to discuss with them first what are the kind of messages youth are more likely to receive, and what is the format of this information that they are more likely to accept, receive, and share as well. And so it has been very interesting experience because those young people actually, because of the nature of COVID-19, they felt really stigmatized because there was a lot of media articles saying that young people, because they have only mild disease, they don't care and they are not cautious enough and they don't apply the protective measures and so on. And they really felt not part of the solution, but rather being the one spreading the disease. And so we work with them to change this perception and ask them, okay, you are the most digitally agile, and so you can make a difference in this digital sphere. So what kind of messages, or how do you want the information to flow so that young people feel engaged and part of the solution to confront this pandemic. And so, for instance, to just give you an example, in the Amazonian forest, a group of youth said, well, in our culture, what is very important is frogs. Frogs are animals we really like. And so all the messages now on washing hands, social distancing, and so on are using frogs as main characters. And so this is a way to adapt the information to the culture, to the context, but also to something that speaks to different generations as well. And we have done the same with a faith-based organization as well, and we have co-developed guidance. We tell them this is what we think is safe for your communities. How would you translate this in your own frame of reference, and how would you apply those recommendations in your community? And so I think it's very important to engage people to be part of the solution as well.
Thank you, Sylvie Briand, for these words. Melissa Fleming, do you want to add anything before we wrap up the interview?
Just to reinforce that the most important thing is to work with communities at local levels. I think sometimes, we believe that we can just send out messages from where we are, and the world, it will penetrate and the world will hear. We need to think globally, but go local. Think globally about the solutions to COVID-19, about the vaccine. No one is safe until everyone is safe. But in order to make sure that everybody it has access to it, but also feels confident in its safety and in the public health system, we need to go and speak to people in the communities and be relevant where people are, understand their fears, and understand also as communicators how to reach the different elements of the population.
Thank you very much, both of you. Thank you for joining us in the SDG Media Zone.